A very important occasion today, Slee.
Quite a pleasant occasion indeed, Marcel. I think 9 months later, finally we're seeing the signing of the Presidential Health Compact, which is meant to basically be a game changer for the health system here in the country, which of course was described as a crisis back in October 2018 during the two-day summit, during the two-day Presidential Health Summit that brought together stakeholders from the health sector, from the public and the private sector, civil society and labor, in order to really draft this plan that's supposed to have deadlines, timelines, and hold every stakeholder in the sector accountable for those deadlines and timelines in order to improve and change the landscape, because of course we know how some of our hospitals, not only in Gauteng but across the country, are already described as mortuaries, dilapidated infrastructure, staff shortages, as well as medicine stockouts that we're seeing in some of our hospitals and clinics. But just to give us some reaction, I am joined by Dr. Steve, who's part of the civil society, in fact, that was part of the engagement throughout the summit. Are we really going to see a change, or was this another talk shop? Is this another signing, another ceremony where we're just going to basically hope for the best?
Well, I mean, look, we're hoping for the best indeed. And then you've seen a couple of weeks ago, Cabinet passed the National Health Insurance, and this is one of the things that we've called for, universal health coverage for the country. What we want to see is action. What we want to see is accountability, it's better coordination, it's better service delivery on time for the people of this country and those who are here. And really, here we are, all of us as stakeholders, we've committed today, together with the President and the Minister of Health, that we're saying as South Africans, we're committing to deliver a better health commitment.
All right, thank you so much. I'm going to bring in my second guest, Marcel, who represents the Health Professionals Council of South Africa. And of course, a lot of issues around staff shortages, a lot of issues around the treatment of patients from health professionals. What is the commitment today from the HPCSA?
The commitment today from the HPCSA is to ensure that our practitioners work in environments conducive for them to practice ethically. We've neglected that aspect, and people work in less than ideal circumstances with patient safety not guaranteed. The video was about patient safety. The President spoke about the example of the Prime Minister of Sweden sleeping next to a steel worker. So what I'm asking South Africans is that you should ensure that as a young person that's vibrant, working and earning, you will be able to sleep where your grandmother or your auntie who's not working is going to sleep. We hope that the mine workers that the President used to represent will now be able to share a ward with the President if circumstances permit. It's about time. We have a system for all South Africans. But people should not kid themselves. It does not mean there aren't any battles that lie ahead. The struggle is just beginning. But at least we've been talking about health for all for 90 years as South Africans. Now the talking is over. Let's get on with it. And the issue of the private-public dichotomy needs to stop. We're not rebuilding the public health for the poor people. We're rebuilding it for all of us.
Thank you so much. All right, as you've heard from both my guests, that today is really just the beginning of what we're trying to see as a change for the healthcare system. I do have the compact in my hand, and basically it outlines through 9 pillars basically how we're going to see the NHI becoming a reality for South Africans, as well as the system really being improved, not only for healthcare professionals but patients as well that are using the healthcare system.
Reporter Slindile Masekane and her guests bringing us the very latest on that story, which will hopefully have a positive impact on South Africans everywhere. Thank you so much for that update.